First up is Professor Helen Marshall. Helen has worked in child health for many years in South Australia, and she is actually a professor in vaccinology, so an absolute expert in this area. Helen's based at the Women's and Children's Hospital and Adelaide University. In the middle here is Dr. Michael Cusack, or Mike for us, and Mike is our Chief Medical Officer in SA Health, and Mike works across all of our hospital systems in South Australia. And last, sitting next to me, is Dr. Emily Kirkpatrick. Emily is a GP, but importantly, Emily has been working with us in SA Health with our COVID-19 response and is one of my deputies, so welcome. So we've got quite a number of questions to get through, and thank you everyone for sending them in. And I'm going to start with a question from Jock, and Jock is asking, who will get it first and when will they get it? Well, we've got some breaking news here in SA today. The first COVID vaccine in South Australia will be given next Monday, which is the 22nd of February. And you've asked who is going to get that. Well, the answer to that is we need to look at who is most at risk from COVID-19. And as many people will realise, it's our Medi-Hotel workers. So our first vaccine will be going into the arm of one of our Medi-Hotel workers. So it will be our Medi-Hotel system. And also, of course, Adelaide Airport, where all of the international arrivals come through. Now, we'll move to the next question. We've got a couple focusing on things pertinent to general practice, so I'm going to ask Emily to answer some of these. This is a question from Claire. Can pregnant women have the vaccine?
Yes, so pregnant women can have the vaccine, but it really is based on a case-by-case analysis in terms of whether you are most at risk of COVID-19. So at this stage, we're not advocating, or we're not saying everyone out there in the general population get vaccinated if you're pregnant, and the reason for that is because a lot of the trials that have been undertaken for COVID-19 didn't actually include pregnant women as part of that. So that's why we're giving that advice now. So it really is a matter of having a chat with your GP or your obstetrician around whether you may be at greater risk of COVID-19 and therefore whether you might benefit from having the vaccine.
Thank you, Emily. Now, of course, after women have been pregnant, they're going to have their baby, and the next question's about this. This is a question from Steph. Can breastfeeding mothers get vaccinated?
Yes, so breastfeeding mothers can get vaccinated. It is very safe to have the vaccine when you are breastfeeding, and in fact you don't need to wait a period of time after having the vaccine to resume breastfeeding. I know that's a common question I often would be asked as a GP. How long do I wait till I next feed my baby? But there's no time period at all, and it's very safe.
Very reassuring, thank you. Now, this is a question that a number of people were interested in. This is a question from Mem, Georgie, and also Kate. Can the COVID vaccine affect fertility? Thank you, Emily.
So no impact at all on fertility. In fact, the COVID vaccine is very, very safe. There's no impact at all on your individual DNA or on the DNA of your potential future baby. So very, very safe, Nicola, to have if you are planning a pregnancy, and no impact at all on fertility.
Oh, that's great. Thank you very much. Now, there's a question here from Chris, and I'm going to ask Mike to answer this one. Can I get the flu and COVID vaccine at the same time?
That's a good question. So Pfizer have recommended that there'll be 14 days clear from having the Pfizer vaccine to having the flu jab, and then 14 days at the other end. So the answer is yes, you can, but you need to make sure you leave at least 2 weeks gap after you've had a vaccine.
So it's still going to be very important to get flu vaccines this year, particularly people in higher risk groups, older people, younger people, and also people with chronic illness. So we're all going to have to do a bit of planning this year and juggle the timing. Now, here's a bit of a tricky one, and we're going to ask Professor Helen here to answer this one. How does the COVID-19 vaccine work? Can you explain this simply?
Yeah, sure. So the COVID-19 vaccine works just like other vaccines do. What's really important in the vaccine is a mimic of the spike protein, which is the protein that actually is in the virus and allows the virus to latch onto our cells, invade our cells, and cause infection. So that's a really important protein for use in the vaccine. And the vaccine then contains a mimic of that spike protein, and when the vaccine is given, we know that the body then develops a really strong, robust antibody response to that mimic protein, so that when that person comes in contact with the infection, they get a surge in antibodies that latch on to that protein that's in the virus and the virus is destroyed. So they're therefore effectively protected against COVID.
Thank you. And another one along the same sort of lines, because there's been, people have heard about these DNA and mRNA viruses, vaccines, I should say, and this is a question about, will the vaccine alter my own DNA when I've had that vaccine?
No, the vaccines can't. Vaccines are not able to alter DNA, and the messenger RNA and the DNA vaccines that are coming forward for COVID-19 protection cannot alter our DNA.
Mm-hmm. That's very reassuring, and it's very good to be clear about that. Thank you. Now I've got a question for you, Mike, and this is a question from Victoria, and she's asking, if it usually takes 10 years to develop a vaccine, how come COVID vaccine can be rolled out in less than a year?
Sure.
Good question.
I think it's a really good question. It is amazing to think that it is, I saw a figure, 333 days after the genetic sequence of the virus had been determined and published, and the first shot was given. So, I mean, it is, as you say, it is normally a process that takes years, and this was done in under a year. And I think there's a few things that has sort of come together and has allowed that to happen. Firstly, it's been a huge global effort. It's had the sort of brightest and the best from across the planet have been working on this, and the resources that they've had available to them have been enormous. Recognising how important this is, manufacture of the vaccine started while the vaccines were still being developed, and obviously governments around the world have bought vaccine even before the vaccine has been available to use. The regulators that have a really important role in determining that the vaccine is safe and effective have been doing their work as the research has been ongoing rather than waiting until the very end. And then I think another key part of this, and this is where the whole community has had a part to play, is that firstly, you can do trials most effectively when there's a lot of the disease around, and people have really put their hand up and come forward very quickly to volunteer and take part in the trials. So I think all of those things lining up has meant that coupled with the new technologies that we have in terms of vaccines has meant that we've been able to do this so quickly.
And you can probably tell from Mike's accent, he is from the UK,
yes.
And that's where there has been a lot of disease, unfortunately.
That's
but
right.
There have been a lot of trial participants in the UK,
yeah.
So we're really grateful for that community.
Thank
as well.
you.
Yeah. Now I've got a question from Deza and Lorraine, and they want to know what is actually in this vaccine. And I thought, Helen, you might be the best person to answer this.
Yeah, so there are a number of different COVID vaccines that are available, and obviously in Australia we have 2 vaccines licensed now. So they do contain, as I mentioned before, the mimic of the spike protein, or they have coding for that protein. For example, in the messenger RNA, it's coding. Otherwise, it is a protein or it's a component of the virus that contains that important spike protein. But it doesn't contain the virus, and it doesn't contain anything live that is of concern. Vaccines also contain a stabiliser or preservative, and sometimes some of the vaccines will have an adjuvant, which again is a very common feature of vaccines, and it really helps stimulate our immune system so we get a really good, robust antibody response to that vaccine.
And what about egg protein? People with egg allergies?
Yeah, so there's no egg in the vaccines that we have licensed and available here in Australia.
Great, thank you. Now this is a question from Leah, Petra and Sue. And sort of following on, I guess, is it safe for people with allergies or people who've had an allergic reaction to a vaccine previously to have this vaccine? And good question for you, Emily.
Yeah, so this is a common question I'd often be asked as a GP for other vaccines. And we know with the COVID-19 vaccine that is available, in fact, there's no allergy risk at all with it. So in terms of egg allergy, that is not a concern at all with the COVID vaccine. And there's no animal products as well as part of it, which is really important. We do know that there are very, very rare cases of what we call anaphylaxis, or those, very serious adverse events where someone has an allergic reaction. And we know that's about 1 in 300,000 is the risk with that. So very, very, very low risk. But that's why we undertake vaccines within healthcare facilities, so that if you did have a reaction, well, then we can treat it at the time and make sure that there's no further concern at all. So very, very safe to have the vaccine, Nicola.
Excellent, thank you. Now, a question from Amanda. Will you be getting the vaccine? Well, I can say yes, 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 I definitely will be. But I want to make sure my mum gets it first because she is at higher risk of getting severe disease than I am. But I'm going to ask all of my panellists the same question. What about you,
Yeah,
Helen?
absolutely. And I don't mind which vaccine, as long as it's gone through the robust TGA process of which the 2 licensed vaccines in Australia have. I'm putting my hand up for either, but like Nicola, I will wait for my turn, and I think I'm a 1B.
I haven't quite worked that one out for myself. What about you, Mike?
Well, I'm going to say the same. I'd be happy to have either vaccine. I think they're both safe and very effective. And as soon as my name comes up on the list, I'll be there.
Yes, and I'm in exactly the same boat. I've got my arm here already.
Yeah.
But of course, I will wait my turn.
And Emily is obviously a little bit younger than the rest of us, so you may have to wait a little bit longer,
sadly.
Emily. Okay, so let's move on. We've got a question from Carolyn. How long does the vaccine provide cover for? Mike, are you okay with answering
I'll
this?
try. It's
Yeah.
a tough question, really, because we don't yet have the research data on this. So I think that's something which is being really actively studied at the moment. What we can say is that, say, 6 months down the track, people appear to have really good protection still. Obviously, having had 2 doses, and I think it's really important that if you get the first dose, you do then, be it 4 weeks or 3 weeks later or 12 weeks later, that you do have the second shot. But as far as we can tell for the time that people have been having the vaccine, it is effective out to, say, 6 months or so. And we believe it will be effective longer still.
Yeah, that's
And
really
probably
good.
to add to that,
Yeah.
that people have actually had COVID infection now, sort of 12 months out, have very high antibody levels. So it's really, I think, we're feeling very positive that the vaccine will have, longer term than perhaps we thought initially.
Oh, that's excellent. So, a question that's a common question. So this is from Leah, Sarah and Mayla. What are the side effects from the vaccine? Now, you would often ask a GP, so I'm going to ask you, Emily.
Yes, so this will probably be a question we'll be asked quite a bit when vaccinating. So we know with any vaccine you can have side effects to it, and that can be anything from a fever, some mild aches and pains, a bit of a sore arm sometimes afterwards, and a headache. And they're all common mild side effects that can be experienced anywhere up to a couple of days after being vaccinated, but of course very mild, and I think that's a really important point to emphasise. So particularly after you're vaccinated, perhaps don't plan to do some really strenuous exercise or sport afterwards, just in case you do have a bit of a sore arm afterwards.
And sometimes you get that with a flu vaccine, don't you?
Yes,
Yeah.
and we certainly anticipate that we'll see the same thing with this vaccine.
And one thing that someone said to me, which I thought was really interesting, was actually if you get a bit of a reaction like that, it means that your immune system's working. So we should actually be a little bit happy if we do get a few of those minor side effects, because we know that our body's had a really good response to the vaccine. Would that be right, Helen?
Absolutely.
Yeah. Okay, so we've got a couple of rather similar questions. So I will start off with a question from Mary. How effective is the Astrazeneca vaccine? And then we've got a question from Elizabeth. What is your opinion about getting the second dose of the Astrazeneca after 12 weeks rather than 4 weeks? So maybe start off with how effective is the Astrazeneca vaccine? Maybe over to you, Helen. And this is a good question because, of course, we know that the TGA has only just given approval for this in Australia this week.
Yeah, so the Astrazeneca vaccine is very effective against COVID-19. It's 100% effective against severe disease. It's also more effective with a longer interval. So that's some interesting information that's come in interval between doses. So that's some interesting information that's come forward just recently, that if you have a difference of about 12 weeks between the 2 doses, it's more effective. It's actually 82% effective. So really we're seeing very similar effectiveness, 82% compared to 95% of the Pfizer vaccine. These are really effective vaccines, and as I said before, I'd be happy with either.
Did you have anything more you wanted to add to that, Mike?
Yeah, I guess, because I think obviously there's a lot made of single figures coming from trials, and I think it's really important. I was talking to Helen earlier, and she was saying it's really important that you have to remember that we're not always comparing apples with apples. Trials have been done in different ways, they've got different people in them. So obviously there's been a really thorough process in terms of registration. The TGA does an amazing job and is highly respected in this, and they have found them both safe and effective, and that's why we have them available in Australia.
Yes, I was just thinking about that longer wait in between doses for the Astrazeneca. I'll have to make sure I get it in my calendar, because you don't want to miss your second dose, you know, because it's been a bit of time. Now we've got a question from Joanne. Is the vaccine safe, and how was the vaccine tested for use here in Australia? And Helen, I think I'll hand that one to you.
Yeah, sure. So the vaccines have gone through the same process that we see for any other vaccine that is produced to protect against a disease. So first of all, preclinical trials are done. So they are trials usually in two different animal species to look at safety. And once that has been shown, the vaccine then is introduced to a phase 1 trial, and people can enrol in a phase 1 trial, which are usually smallish numbers, to check that the vaccine is safety before it then progresses to phase 2 and to phase 3. And in the phase 3 studies, we're really looking at tens of thousands of people enrolling in those studies. And as Mike was alluding to, I mean, that's how we are, that's why we are here today, because so many people, more people put their hands up than were positions available in the clinical trials. So fantastic public response. And once you have the data available from those trials, all of that information is reviewed by the Therapeutic Goods Administration before a vaccine can be licensed in Australia. And as you can appreciate, we are introducing the vaccine here in Australia later than for other countries. I just looked last night, there have been 175 million doses already given around the world. So I think that's so reassuring about the safety, but I'm completely confident in the Therapeutic Goods Administration process. I was a member of ATAGI, which is the group that looks at the scientific evidence, so I know what happens, I understand the processes, and I'm very confident in the whole process here in Australia.
Oh, that's very reassuring, and we're very pleased that you work here in SA and we have such an expert. Thank you. So I've got a question from Carol, and I think I could answer this one, but I'm going to ask you, Emily. Is the vaccine mandatory?
No, so the COVID vaccine is not mandatory, and it is really important that you do have a chance to have really informed consent before you have the vaccine. Have a chance to read through the frequently asked questions, and also the vaccine information that will be available on the SA Health website, and also on the Commonwealth Department of Health website as well, to have a good read through before you have the vaccine. But no, it's not mandatory, Nicola, but it is really important if you do work in a high-risk setting, or you're working in a medi-hotel, in the quarantine pathway, or perhaps you might be swabbing for COVID-19, to have a discussion with your employer around what your risks may be if you're not vaccinated.
That's an important point. And also, I keep being asked by people, you know, when will life go back to normal? What about your crystal ball, Nicola? And what I can say is it's more likely to go back to normal more quickly the more people get vaccinated. So whilst it's not mandatory, of course, we would like to encourage people. We really want lots of South Australians to get this vaccine.
And it would be great to see what's happened as in Israel, where 70% of the population are vaccinated and 90% elderly. So, you know, that would be great.
Very interesting to have a look at those results, yeah. Now, I've got a question from Mike, but it's going to go to Emily. And Mike is asking, how and where can I get the vaccine in South Australia?
Yes, so there's lots of places that you'll be able to get the vaccine here in South Australia. As part of the first phase of the vaccine, we are rolling it out within our two major hospitals to begin with next week, so the Royal Adelaide Hospital and Flinders Medical Centre. And then we're having a stage rollout across the state. It's really important that we do vaccinate those most at risk, so particularly our more elderly populations, those who are in residential aged care and working in residential aged care as well. And then after that, we'll be moving to a more wider spread rollout. And as part of that, we will be having GPs. So GP clinics have put their hands up to vaccinate, and also pharmacies as well. So we'll see that as we roll into the further phases of the vaccine. But there'll be lots of opportunity and many places for you to go to. But of course, it is part of that booking system that will come out over time when you'll be told when's your turn to be vaccinated.
Thank you very much. Question from Cherie. Can children get the vaccine? And I'm a paediatrician, and of course I want to know the answer to this one, and I'm going to ask you, Mike.
Well, so far it's been licensed for people who are 16 years and older, and the reason is that in the trials that have been done so far that they haven't included children, and that's a fairly normal situation. Obviously, the big question is then, should we vaccinate children? And the trials that are happening at the moment to try and answer that question. So we may have clues about that a bit later in the year, but at the moment it is for over 16s.
Okay, thank you. Now, this is a question that's been asked by quite a number of our viewers. So it was from Amanda, Maggie and also Ewan. And they've asked specific questions about people with rheumatoid arthritis, type 2 diabetes and Crohn's disease. They want to know about people with these sorts of health conditions, some of which impact your immune system. They want to know whether these people should be getting the vaccine. Emily, could I get you to answer that one?
Absolutely, Nicola. So it is very important that if you do suffer from a chronic medical condition or one of those conditions that Nicola mentioned, such as rheumatoid arthritis, or you're on a immunosuppressive therapy, it is actually really important that you do have the COVID-19 vaccine. And the reason for that is because you are more susceptible if you do develop the virus of having a worse outcome, unfortunately. So that's why it's so important. But of course, it is actually really safe as well to have the vaccine if you are in that group. And that's why we've specifically focused as part of the phase rollout of putting those most at risk if you do have a chronic medical condition or you are in one of those early groups. It's important you do have the vaccine early this year.
And I guess one of the other groups would be people with cancer and having cancer treatment. Would that be the same?
Yes, absolutely. So very safe. But look, if you do want to have a more in-depth conversation, you can certainly have a discussion with your GP around that. And I'd always suggest that, being a GP myself, you would have a chat with your GP about this. But it is very safe. And I think that is a common question people do ask for any vaccine or any medical treatment that they have. How safe is this with my other medications? And it is very safe.
Thank you. And another specific question about who can get the vaccine. This is a question from Nikki. Can older people get the vaccine, and is it safe for older people? And I know that there was some media around, I think it was the Netherlands, a month or so back. So anyway, Mike, do you want to have a go at
Well,
answering
definitely. This is, and just to build on the point as we were just talking about, we are really keen to vaccinate those who are most at risk. And, you know, sadly what we've seen overseas in particular is that in older populations, in older people, it is more likely to have adverse consequences and bad outcomes. So we would be really keen to vaccinate elderly people first, and that's why in the phases that we talked about, 1A, 1B and so forth, that we're starting to vaccinate older people in 1A and certainly carrying right on it into 1B as well.
Mm-hmm. Yeah, great, thank you. And another one for you, Mike. This is a question from Victoria. I'm fit and healthy. Won't my immune system protect me? What do you think?
Well, to an extent, but again, what we've seen overseas is that that everyone can catch COVID, and although, as I've just said, worse adverse outcomes and even death is more likely to occur in older people. Sadly, there's been a significant number of serious disease, of serious cases, and even deaths in younger people. And obviously, it's such a tragic thing, and it's so easy to prevent it.
Yes.
And we've got such, vaccine is great technology, and we can actually stop the disease in its tracks. So I would really encourage people, irrespective of age, that they please do get themselves vaccinated.
Yes, and I have heard from people who have had COVID that even some relatively long time afterwards they're still getting some symptoms, feeling tired, fatigue, muscle aches and pains and such like. So even though it might have not been very severe at the beginning, it can actually have this long-term impact on people. So the last question is, and this is a question I have been asked a number of times, if we all get vaccinated, will the borders stay open and can we dance? And I love dancing, and I'm very much looking forward to getting back to a bit more normality. And those sorts of things like being able to dance and go out and have fun and all of those wonderful social activities really is the fabric of what keeps us together as human beings, isn't it? To be able to interact with each other. So the answer to that is it will definitely increase our chances of being able to get back to that. The important thing thing is the more people that get vaccinated, the more quickly we will be able to get back to that situation. And if we don't have a good uptake of the vaccine, unfortunately the pandemic could drag on for a lot longer. So definitely this is a really good reason to think about being vaccinated. So I think we've come to the end of our questions today, and that they have been really great questions, and it's been wonderful to have input from these great panellists. So I want to thank you all for being here today and for answering the questions that the South Australian community posed. Thank you very much for joining us.